Here's a puzzle for you. What if I told you that in one of the sunniest places on the entire planet, millions of kids are deficient in, of all things, the sunshine vitamin? It sounds completely backward, right? Well, it's a real and growing health crisis. Today, we're going to unravel the vitamin D paradox.
Yeah, we're talking about India, a country that is just drenched in sunlight for most of the year. You would think, logically, that a vitamin D deficiency would be the absolute last thing anyone would have to worry about here. But that's exactly where this whole mystery gets started.
And this is the central question we really need to dig into. How is this even possible? Is it because modern lifestyles are keeping kids inside? Is it something about their diet? Maybe pollution blocking the sun? This isn't just some interesting riddle. It's a serious public health issue that could affect an entire generation of kids.
All right, let's dive right into the heart of this paradox. First things first, just how big of a problem are we actually talking about? The numbers, which come from a huge national survey, well, they might just shock you. So the data we're about to look at isn't just a small sample. It comes from the Comprehensive National Nutrition Survey. This was this massive government study that looked at over 35,000 children all across India. It gives us this incredible, unprecedented snapshot of just how widespread this issue really is. And what the survey found is, well, it's a really disturbing trend. It seems the older kids get, the more likely they are to be deficient. It starts at about 14% for the little ones, the toddlers. Then it climbs to 18% for kids in primary school. And then, get this, it jumps to a staggering 24%. That's almost 1 in every 4 teenagers. Okay, but hearing a word like deficiency is one thing. What does it actually mean, in medical terms? To really get a handle on the problem, we first have to understand the numbers that doctors are actually looking at in a blood test. So the magic number here is something called serum 25-hydroxyvitamin D. I know, it's a mouthful, so let's just call it 25-OHD. This is the key marker in your blood that tells the whole story about your body's vitamin D levels. And here are the official cutoffs that pediatric experts in India and around the world have agreed on. If your level is below 12 nanograms per milliliter, that's considered a full-blown deficiency. If you're in the gray area between 12 and 20, that's called insufficiency. The goal, the sweet spot, is to be above 20. That's sufficiency. But, and this is so important, more is not always better. While we're focused on deficiency, you have to know that letting your levels soar above 100 ng per ml can actually be dangerous. It can lead to something called vitamin D toxicity, especially if your calcium is high too. So balance is absolutely everything. Okay, so we've established there's a huge problem, and we know exactly what we're looking for in the numbers. So the next big question is, what do we do about it? How do we fix this? Let's look at the official guidelines for prevention. Who actually needs to be taking a supplement?
The guidelines are actually super specific on this. Giving supplements to everyone in a group, that's called universal supplementation, is not recommended during pregnancy or for healthy older kids and teenagers. But it is strongly recommended for all infants, from birth up to 1 year old. They need 400 international units, or IU, every single day. The only other group that needs routine supplements are kids who are considered high risk. So what does high risk even mean? Well, we're talking about children with very specific medical conditions that mess with how their bodies absorb or use vitamin D. We're talking about things like chronic kidney or liver disease, kids who are on certain long-term medications like steroids, or children who have conditions that limit their mobility. So what about all the other healthy kids and teens? The guidelines are crystal clear. Their daily need, which is about 400 to 600 IU, should come from natural sources. That means a combination of getting some sensible sun exposure and eating a balanced diet, not from popping supplement pills every day. Okay, but what happens when prevention isn't enough, and a child is actually diagnosed with a deficiency, or even a related condition like nutritional rickets? Well, for those cases, there's a very clear and effective treatment plan. Now, this might look a little complicated, but it's basically the roadmap that doctors follow. It's a flowchart from the Indian Academy of Pediatrics that helps them make sure they've ruled out other possible causes before they lock in on a vitamin D deficiency and start the right treatment. And once that diagnosis is confirmed, the treatment is direct and it's pretty powerful. It's a 12-week course of high-dose vitamin D3. We're talking 2,000 IU a day for babies and 3,000 for kids over 1 year old. And look closely, calcium is prescribed right alongside it. You absolutely need both for the treatment to work and for those bones to heal properly. Now, you've probably seen the headlines. Vitamin D is supposedly a miracle cure for, well, just about everything, right? But what does the actual science say, especially when it comes to kids? In this next part, we're going to separate the hype from the hard evidence.
You see it all over the internet. Vitamin D can help with asthma. It can stop infections. It can fight obesity. The list just goes on and on. But here's the thing. Just because two things are linked doesn't mean one causes the other. So, is there any real truth to these claims when you put them under the microscope? Let's see what the expert panel found.
Let's start with a big one, pneumonia. The claim is that vitamin D can help, but the evidence? Well, the guidelines are very blunt about this. They say that while it's true that kids with pneumonia often have low vitamin D, study after study shows that giving them supplements doesn't actually help treat the illness. So no routine supplementation is recommended. It's a very similar story for asthma. Yes, scientists have found a link between low vitamin D and having asthma. But again, when you actually test it in proper clinical trials, giving supplements to kids with asthma has not been proven to be beneficial in managing their condition. The evidence just isn't there. And this slide really sums it all up. After looking at all the available evidence, the expert panel does not recommend using routine vitamin D supplements to treat or prevent a whole list of other conditions in children that includes diarrhea, tuberculosis, HIV, and even obesity. So the bottom line here is actually refreshingly simple. When we talk about giving vitamin D supplements to children, the one area where the evidence is rock solid is bone health. The main proven focus should be on preventing and treating deficiency to build strong, healthy bones.
Okay, let's lock in the key takeaways from all of this. Number 1, all infants need a daily 400 IU supplement of vitamin D, period. Number 2, healthy older kids and teens should get their vitamin D the old-fashioned way, from sensible sunshine and good food. 3, if a deficiency is diagnosed, treatment is a specific, high-dose plan that must include calcium. And finally, number 4, don't use vitamin D for other illnesses without a doctor's advice. The evidence just isn't there yet.
So there you have it. The facts straight from the experts. The sunshine vitamin paradox is definitely complex, but the recommendations for what to do are actually very clear. It really just leaves one final question for you to think about. Based on all this evidence, what's the right vitamin D playbook for your family? The best way to find out is to talk to your doctor. Thanks so much for joining us.